right, everybody, let's say good morning to Delna, Dr. John, who's going to be giving us her senior lecture. So pay close attention and learn yourself something.
Hi guys, good morning. I feel kind of weird introducing myself, but I'm Donna, one of the fourth years, and I'm going to give you guys my senior lecture today. Sorry, too early. So I feel like I have to go into the spiel of like, what should I do for my senior lecture? It was super hard. Everybody says it, and it was super hard. I thought about a million topics, a lot of them crossed out really quickly. Some of them that I thought of, I figured I would go through. So this is my my best work yet. If you Google search my name, she studied this in various settings, cadets at West Point, other kids, Chicago inner city school. But ultimately she defined that talent actually did not determine success. And there was one factor that did, and she coined that term grit. First, she defined this as perseverance that's long-term. So for very long-term goals, for years, not just short-term. This is sustained effort. So we think about grit, we think we all have it, right? So we went through med school, residency, some of us have been through things in life. There's probably not a single person without it. But when we look at the actual trajectory of residency, when we come in ready to be rock stars in about 4 years, we realize that it doesn't really look like the one on the left, but the picture on the right is a little bit more of a representation of what our pathway really looks like. How in the world do you get through that without giving up? So that's where the concept of resilience comes in. So resilience and grit are kind of intertwined. So that's your basis for what grit actually is. Resilience implies that you struggled, faltered, or failed, but you've picked yourself up again. And that concept requires a little bit of optimism. So the classic definition, the American Psychological Association defines resilience as adapting well in the face of adversity, trauma, tragedy, threats, basically stress. It means bouncing back from difficult experiences. So this is what we define as perseverance for long-term goals. So what is grit? Is it a trait? Is it a process? Is it an outcome of stress? There's been a lot of research starting out initially in the 1970s when people started to study kids, just like Angela Duckworth did, how they developed despite having a difficult upbringing. Now, that come out stronger after adversity. Maybe there's something inside of them that can't really be learned. Then we developed the process hypothesis. So this is more of like dynamic adaptation. So once you go through these adversities and these stresses and trials, resilience develops. All of these hypotheses, regardless of what they are, have something in common, and that's adversity and positive adaptation. So this graph kind of represents the stages of that, or the stages of resilience, based on what was studied. So survival, adaptation, recovery, and ultimately, if we get there, growth. So what are some of the behavioral characteristics of resilience, or what do we think of? So these are some of the things that have been shown through research to be associated with people who are resilient. Some of those things involve active coping, optimism, cognitive reappraisal, which we'll talk about, pro-social behavior, and you guys know social support. So what is active coping? So active coping is actually a strategy where an individual controls a stressor through targeted behavior. This implies some sort of self-efficacy and being a self-starter. This is a little bit different from passive coping, which involves avoidance, withdrawal. I do quite often. Active coping is very different. Optimism. So that's number 2. What is optimism? So we all kind of have an idea of what optimism is. There's been this concept of learned helplessness through psychology research, and Dr. Martin Seligman, who's the founder of PEN, I think, what is it called? PEN Positive Psych, or PEN Positive Psychology, is basically an organization that heads multiple resilience training programs based out of UPenn. He wrote this article in the Harvard Business Review, and he talks about this replicated experiment. He started this first in 1975, and then it's been replicated through the years. And basically you have these subjects and they're divided into 3 groups. The first group hears this loud, super annoying noise, and they can turn it off just by pressing this button. They have to press it pretty hard. The second group hears this really loud, annoying noise, and they cannot turn it off no matter how hard they press. And then the third group does not really hear anything at all. So he found that the next day, when he exposed them to a similar super annoying loud trigger, any of the groups could turn off that trigger by just waving their hands about 12 inches in the air. He found that the first group figured that out fine, so did the third, but most of the second group did not. What's interesting is he found that among all the groups, about 1/3 of people, regardless of whatever group they were in, if they could turn off the noise or not, figured out that they could turn off the noise in the second experiment. He uses to kind of coin the term learned helplessness. So we learn to expect failure. And so you kind of stop trying at all. There's a group of people, for some reason, that never do this, that continue actively trying to figure it out. Why is this? So that's where the concept of optimism kind of comes in. He realized that there are certain people who don't have a habit of giving up and view stressors as temporary, local, and changeable. That's rare. Pro-social behavior. So I wanted to talk about this a little bit because this is a little bit different than social support. So we all know that social support breeds wellness, as we like to coin it, and makes us happy and is good for us. But pro-social behavior is different in the sense where it's behavior that's not necessarily characterized by support, but really by empathy. It's behavior that's grounded in caring about the rights and the welfare of other people. And research has actually shown that this is a positive trait that's associated with resilience. And this actually improves mental health on a day-to-day basis. There's that common saying, by helping others, you help yourself. Social support. So I won't go into this in too much detail, but we all know the research behind social support. We all know it's positive towards health, both physical and mental. But what's interesting is there's been a lot of research that's shown that it's not really the amount of support you have, but the quality of support you have. So it's not the amount of relationships, but the quality of the relationships you have in your life that determine the positive impact it could have. So this is complicated. There's a whole host of studies and research that go into this, and my brain started hurting a lot when I started reading it. But I'll keep it simple for you guys. There is actually a neurocognitive basis for resilience and adapting well to stress and adversity. There's actually a circuit, and some of the areas that are implicated are the median prefrontal cortex, the anterior cingulate cortex, the amygdala, and the hippocampus. These circuits are actually involved in your stress response, in your perception of pain, in the brain's reward experience, and in cognitive flexibility. So in taking in all of this information and the ability to switch between frameworks in your mind to adapt well. We talked about this a little bit. And studies have actually shown that prolonged adversity, so if you are experiencing repetitive stress, it actually can affect these circuits and decrease your ability for task switching or cognitive flexibility. So why is this so important? That's a lot of words. You guys all know that resilience is a relevant topic to us in emergency medicine. Why? So we all know that we rank highly in burnout surveys. So basically, I think the last ABEM one in 2016 showed that burnout actually increased from 1996 to 2016 in residents, despite the fact that we actually have more time. Why is that? Recent surveys actually showed about 46% of physicians are experiencing this, and a lot of us are too. I'm not going to go into burnout. We know it's complex. We know it's more than just being tired. It involves emotional exhaustion, depersonalization, and really low feelings of accomplishment. I'm sure every one of you in this room has felt this way. And we know that it increases medical errors. Resiliency is relevant to that. Consider your normal routine, getting ready for your work. 5th night in a row as a junior, rest assured the first 10 minutes of your shift, think back to like a couple months ago, You probably had about 5 or 6 interruptions, a conversation, the lab yelling for criticals, I can't pronounce your name, an angry family, goes on and on. Maybe you're having a goals of care discussion, and just when you're having that discussion, you get a trauma code. So challenges and adversity are actually really inherent to our field, not just in residency, but in our entire future careers, and we chose this. So when we think about that, the concept of wellness seems kind of silly, right? How can anyone be truly well when you face this adversity every single day? But I think what we're talking about a little more is resilience when we talk about wellness. Resilience is a little bit different in that in our minds, it means how do we use these challenging stressors, this unique environment that we're in, and how do we use it in a dynamic way to allow us to build strength and resilience. Okay, I want to talk a little bit about compassion fatigue. So we're going to talk about what are our challenges to resilience. Compassion fatigue is interesting. So have you guys ever felt, it's a silly question, but I'm sure you've all felt overwhelmed by the suffering you see at work. I know personally, I feel like this often, and I definitely felt like this as an intern when I first walked through the pod with everybody calling out your name, whether it's nurse or doc. It was overwhelming. I remember being a second year and this kind of building up and building up. I remember I had a really sweet elderly gentleman in the pod, and was a really poor historian. It was a rough shift, and I had patients that were a lot more difficult than he was. But for some reason, I think I just blew when I was treating him. Could not tell me why he was there, except that he was weak. Couldn't answer my questions, was getting nowhere, was a really difficult stick, and for some reason needed a CTA. Didn't know where to go from there. I remember talking to him and listening to the way I talked to him. Everything I said was short. It was angry, it was irritated, and I could hear it in my voice. And I was surprised when I thought back about how I talked to him. Turns out he had metastatic prostate cancer, and that showed up in his CT, and that was the reason why he felt diffusely weak. Needless to say, I felt horrible. I went back and I remember saying sorry to him, and he had no clue what I was talking about. I remember him just looking at me with a silly little smile on his face, had no clue what I was saying. I just kind of gave up and gave him a smile and walked away. But that kind of shows this is an example of compassion fatigue. Compassion fatigue basically happens when you have an already burned out person combined with some kind of secondary trauma. Secondary trauma happens in people that treat those who are exposed to traumatic events, even though you're not going through it yourself. This happens to us often. We see this every day, especially in the time that we're in. And this eventually can lead to you not being able to function or give any form of empathy at all. What about second victim syndrome, or what happens when you make a mistake? I'm not going to go into this too much, but how do you guys feel when you have a bad outcome, if you've had a bad outcome? I'm sure for those of us in our 4th year, we've probably had one already, or had one of our cases at M&M. I know I feel terrible. Medicine is high stakes, but emergency medicine is super high stakes. We put ourselves in that environment every day. We all have cases we just cannot forget, names that are etched in our minds or faces that are etched in our minds. I know for me, it was a 50-year-old woman, and I remember being downstate as an early 3rd year, ended up, long story short, she had TTP. But by the time we found out she had TTP, it was a little bit too, I don't know what the saying is, but it was too late. By the time we got our labs back and figured this out and got the Shiley, she was already on her way to the end. Just as my 7 a.m. colleague was putting the Shiley in, remember that was Ronnie, she coded. And I remember going to tell the family, we all stayed late, and I remember being in that code and then having to go and tell the family that she passed. I remember hearing for the first time the family's words. She looked at me and she said, "You killed my mother." And she said, "I wish we never brought her here." And I remember usually say that don't mind goals of care conversations at all. I appreciate sitting down with those families, but I couldn't talk anymore, right? And I had to walk away. And I remember sitting in the ambulance bay, and Dr. Wolfram just sat there, and I remember crying. And I remember doing that for a while and then going home and doing that. And I remember feeling like a really bad doctor and a really bad senior for weeks. I remember I struggled with leadership, making decisions. I wondered if I could ever be trusted in the future, and if I just didn't cut it. Thankfully, I had some awesome colleagues who helped take care of her, but this is called second victim syndrome. When we make medical errors, sometimes that error can leave us as physicians with this overwhelming sense of guilt and shame and this feeling that we betrayed our patients, and that can translate into weeks and sometimes months and sometimes years. That can ultimately lead to more error. Have you guys felt like this? And maybe if you feel like this, you still feel inadequate. So what do we do? What's the answer? Basically, we know the characteristics that are associated with resilience. So optimism, the desire to help others, a support system, all of that good stuff that we came in thinking we would be pros at. Now we realize life is pretty hard. So how do we keep going? How do we become resilient people and physicians through this and take care of our patients and take care of ourselves? It seems like our environment is counterintuitive to this, but I guess I argue that inherently, the fact that we all chose to be here says something about you. And the fact that you chose to go into adversity says something about who you want to become. I don't think there's any clear-cut answers, or at least I don't have any. I don't really have any techniques or anything like that to give you, but I think there are a couple ways we can foster a different mindset within ourselves to build ourselves as more resilient people. So I'm going to talk a little bit about the fixed versus growth mindset. So Carol Dweck is a professor of psychology at Stanford University. She described the importance of a growth mindset to success. So if you've got a fixed mindset, you believe that your qualities are fixed, your intelligence, your procedural capacity, your skills, all that stuff is fixed. So you're going through life constantly trying to prove to yourself and to everyone else that you're smart enough, that you're good enough, that you're capable enough. In a growth mindset, you know that your talents, your skills, your abilities, they're ever changing, they're dynamic. And you're no longer proving yourself. You're no longer proving yourself to others, but rather you're just looking for an opportunity to grow. I would argue that this leads to an immense potential, basically to seek out feedback, to improve, and to thrive during some of the most difficult times of your life. How do we do this? So step one is to give yourself a little bit of grace. A fixed mindset means you let go of the idea that you have to be perfect. That's really hard for most of us to do. I know that's hard for me to do. I know that's hard for all of you to do. But this is key. You've got to give yourself, and I have to give myself, room to make errors and room to grow. When you embrace these imperfections, it helps you face your challenges, right? And now we can turn fear into more of an opportunity for growth. Step two is positive self-talk. So this is interesting. Just take one day or take like a couple hours and just observe the kind of thoughts that you think in your mind regarding yourself. See what happens when you make a mistake. I have done this, and I was definitely floored at the amount of negativity I spoke to myself daily. These are things that you or I may never say or think about another person, but we often think those thoughts about ourselves or hold ourselves to that super high standard. I'm sure some of you are similar. How do you treat yourself in your mind? Our thoughts are vital to our capacity to face challenges and come out stronger. So I try to pay attention to this. Consciously, actively make an effort to replace one of those negative thoughts with something positive, and judgment with a little bit of acceptance. I would say that this builds optimism, which then breeds resilience. So what's the purpose of it all? So purpose, a lot of studies on resiliency have actually shown that people with a greater sense of purpose, which is defined as the desire to make a meaningful contribution to the world, showed better emotional recovery following a negative experience. Can you remind yourself for a second why you went into medicine? I think this is hard. Sometimes we become cynics. Life is hard, work is hard, and cynicism takes that purpose away from us, and we wondered where that person we once were went. I would say that despite that, think long and hard about why you went into this at all, or why you're doing what you're doing. Being rooted in purpose for something greater than the day-to-day tasks makes it less mundane and is the key to resilience. So I wanted to share a quick quote from the same article in the Harvard Business Review. Resilient people build bridges from present-day hardships to a fuller, better constructed future. Those bridges make the present manageable, for lack of a better word, removing the sense that the present is overwhelming. Basically, that just means to me that the most resilient people try to make meaning out of hardship, and that results in greater motivation, perseverance, and innovation. Cool. seek out peer support. So that's pretty easy. I would just say that we have a giant network here, right? But it's interesting. Sometimes you get tired, exhausted, and you may feel like you're alone. I don't think peer support necessarily means that you are constantly talking or always talking to people about the hard stuff, although that's important, but seek it out in whatever way works for you. I think this is a part of active coping based on reading. It's hard to do this at all, but I would argue that the longer you let that stuff fester in your minds, it'll eventually come out. Push yourself. So I would say that this is probably what I felt like my everyday in residency. But I would say to make yourself uncomfortable. Part of resilience is adversity. Part of that is going to help you grow. I think when we think traditionally of wellness, although it might not seem that way, being comfortable might mean that we're more well, but I don't think that's the case. So this could be in the clinical area, leadership skills, learning a new skill set, whatever it is, try something different, push yourself, do something that you don't think you're good at. So in summary, I think grit is actually dependent on resilience, which means the ability to adapt well and grow in the face of adversity. There is neurocognitive basis to resilience, and our neurons are plastic, these connections are plastic, so we can grow resilience in our minds. Resilient people exhibit our growth mindset, but we can learn that and develop that. And that mindset is dependent on a strong sense of purpose, self-forgiveness, optimism, and a strong desire for continuous learning and improvement. I want to say thank you to Dr. Locascio, Dr. De Niro, Dr. Alfonso, Shan, and Dr. Ahmad for going through this lecture. I want to thank you guys, my co-residents, for the chance to work with you and get to know you. You guys know I always say you inspire me every day. I don't think work is as fun anywhere else as with you guys. I'm definitely going to miss you more than you miss me. I want to thank Dr. Locascio, who's been my mentor through my entire time here, Dr. Willis and all my APDs, my awesome attendings, and all the mentors I gained along the way. I look up to all of you, and I can't believe I got lucky enough to train here and call County my home. Last but not last, but I want to thank my amazing class. You guys have been my source of support, my safe place, and a constant source of laughs for the last 4 years. I love you guys so much, and I want to thank you for that. Good old days. Last but not least, I want to thank the guys who have become my family in the last year. To Derek, Ronnie, and Rithvik, thank you for being the best co-chiefs a girl could ask for. And last but not least, thank you to my fiance and my parents for putting up with me. That's it. You guys have any questions?
It was very well done. I've never heard a lecture on that before. It really was well done, well thought out, very relevant. Great.
Thanks, Dr. G. Okay, thank you.